All right, good afternoon, everybody. My name is Carl Redlining. I'm the Executive Director of the Greater High Point Food Alliance. And this is the first time that we have ever hosted a webinar. And this Lunch and Learn series actually came out of our food summit, where people were asking for more information, more depth on the topics that we discussed during the food summit and some things that we didn't quite have time to get to. So we're really excited about today. Just as information, this whole thing will be recorded. And Eli Saavedra is going to be our presenter today. Let me share a little bit about Eli. First, I knew Eli when he was an intern with Second Harvest, later the kitchen manager for the YWCA here in High Point. And today, Eli is the board chair of the Greater High Point Food Alliance. And in his role with the health department, he is a registered dietitian. He works with community organizations to develop and implement collective efforts to address hunger and provide nutrition education across the county. He leads the division's health equity core team, working to operationalize health equity in all programs and services. Eli completed his master's degree in nutrition with a concentration in public health at the University of Alabama. Roll Tide, he would say. Eli is a husband, son, a brother, a friend, a lifelong learner, and a foodie. As we're going through this, you'll be able to put questions in the Q&A. If you like one of the questions been asked, then you can upvote it or hit like, and it'll move to the top of the surface. And then we will try and answer all your questions at the end of the webinar. If we don't get to it, please leave us your email address and one of us will respond back. We really do appreciate you being here. This is really an important topic. There are so many different things that impact food security and health outcomes. And there's a history of redlining across the nation. And so Eli is going to be talking with us about local redlining, the history of it, and then what are some things that are going on today. There will be a crossover between Greensboro and High Point, that we have this artificial barrier we call Jamestown. There really is no separation in our communities. In the work that we do, we see people going back and forth all the time between these two major urban cities. So you'll see some crossover, which is to be expected. So again, thank you for being here. Thank you for taking the time. And after we're finished, we're gonna have a survey that we're gonna email out. It's really important for us to know your responses so that we can continue to improve what we do and learn some other things that we might be able to do in the future. So thank you for being here. Eli, I'm gonna turn it over to you.
Okay, can you hear me now? Perfect. I think I'm unmuted. Great. Thank you so much, Carl, for that introduction. As Carl mentioned, my name's Eli Saavedra. I'm a registered dietitian with the Guilford County Department of Public Health, and I'm coming to you live from Guilford County, Greensboro to be specific. To help us capture who's in attendance today, if you would please include where you're coming from, what your name is, where you're coming from. If you feel comfortable in the comment section, we'd love to know where you're coming from today and where you're watching from. So it's my pleasure to be the first one to lead a webinar on this topic, especially as we have some other great topics coming up. But I'm passionate about advocating for our community, and I hope that you are as well. And so this is a very important topic that I think it's relevant for today, and I think it's going to be relevant in the future as we continue to plan and create programs and services for our community and those who have been underserved historically and currently. So my presentation today aims to provide a new narrative, if you're new to this topic, on health outcomes, specifically in Guilford County. So today, what we hope to discuss, or I should say, I'm breaking this up into 4 parts. Number 1 is talking about what social determinants of health are, then provide some historical context, then going into redlining, and then discussing the lasting impact that redlining has had on health. Now, we know that biology and genetics and personal choices have their say in our well-being, but we also recognize that socioeconomic and environmental factors play a big role in impacting our health. And so I wanted to make sure that I define what social determinants of health are for us. And so this is from Healthy People 2030. And so social determinants of health are reading for us, the conditions in our environment where people are born, live, work, play, worship, and age. And as we know, these can have a wide range of health and quality of life outcomes and risks. So it's well documented that folks who live in under-resourced areas, in what we would call food insecure areas or concentrated poverty, have worse outcomes than the rest of the population. So as we consider the social determinants of health are those things that impact health outcomes, I want you to start considering like historical implications of things and start asking yourself, how is it that certain communities continue to face the same issues or continue to have the same problems? And so let's take a look at the historical context and to try to understand what's happening in our history, to try to understand what's going on today. So let's see here. So to truly grasp how these social determinants of health drive our health outcomes, we need to take a look at, we need to take a step back and look at the bigger picture, as I mentioned earlier. So let's look at our history a little bit. So what I hope to do again is provide you some background information and then take us into redlining and to see how that came about. So after the American Civil War, the Reconstruction period saw a huge backlash, I would say, on the 13th Amendment, which abolished slavery in the United States. However, because of this backlash and opposition, there were folks who wanted to limit freedom for enslaved people. And what these Black codes were essentially was that they wanted to determine where people worked, how they worked, when they could work, and how much they got paid. But also, this was also about control, being able to have control about where people went and restrict movement and freedom. So this brings us to, again, the Black codes, which were later called the Jim Crow laws. So the Jim Crow laws became a term that described a system of racial injustice in the American South that lasted nearly 100 years. So, which is fascinating because they started around 1866 and they went all the way to 1967. So if you do the math, that's pretty recent. So from that, we can assess that they've had a lasting effect on our health. And I mentioned control earlier because these are some of the issues that we're still sort of seeing today. But again, the Black codes were about limiting freedom, opportunities for employment, compensation, voting rights, and about where people lived. So let's continue to go through some of our history. So the Black codes affected every part of Southern life, dictating everything from racial segregation to social etiquette, most infamously through racial segregation in schools and public spaces. But you also see oppression in the etiquettes and behaviors and how people related, especially the interactions between our white neighbors and our Black or people of color. But they were also about limiting civil rights to Black Americans and people of color. I wanted to mention that the Peggy versus Ferguson court case, in which the U.S. Supreme Court decided that rail carts should be segregated. There should be separate seating arrangements for people who were Black versus those who were white. So interestingly, this expanded the Jim Crow laws across the United States. And so again, I mentioned that this lasted about 100 years, from 1866 to 1967. So we start to see I hope that you're starting to see a connection between the end of slavery to Black codes, Jim Crow laws, to now separate but equal clause. So I mentioned that these expanded across the U.S. And so what I found fascinating through my research, and this is no surprise, I'm sure this is no surprise to anyone, but because they expanded, they infiltrated every area of life, just about. Segregation was implemented in parks, schools, restaurants, prisons. You see the list here: libraries, cemeteries, municipal services, and restrooms, and amusement parks. Here's a picture here on the screen from, and this is Durham actually. So you see the different entrances here. This is for whites only, and this is for colored. So it's quite fascinating to look back at history and see how the policies have influenced and impacted the opportunities available to everyone. So I mentioned earlier about the historical context and being able to look at the bigger picture. So let's continue to see how Jim Crow in North Carolina has impacted health outcomes. So redlining, I'm going to cover redlining here and go over just a few descriptions of what redlining is. So redlining, excuse me, is the discriminatory practice resulting in denial of mortgage loans based on race and class. So this was done in the 1930s, or after the Great Depression. The federal government implemented a program to increase housing supply and segregate access to housing. So suburban subdivisions were subsidized with the condition that homes be sold only to white individuals. And I want to highlight two programs here that are quite famous, or that were launched during this time. Number one is the Homeowners Loan Corporation and the Federal Housing Administration. Interestingly, one of the things that they have in common that they share is the practice of redlining and discrimination against Black Americans and low-income Americans in the mortgage market. So this redlining policy prevented African-American families from buying homes in primarily white neighborhoods by appraising their neighborhood as too risky for mortgages and insurance. So not looking forward a little bit, evidence has shown that this policy decreased property values of African-American neighborhoods and perpetuated segregation. So let's continue to learn a little bit more. So I mentioned earlier that the Homeowners Loan Corporation, or redlining specifically, assigned specific grades to specific neighborhoods based on class. And what's interesting about this is that they considered, so they looked at who lived in these neighborhoods, their income level, and the condition of the neighborhood. What you're seeing on the screen now is a map from 1936 from the Homeowners Loan Corporation. And I want to point out the different grades these neighborhoods were given. So they were given a score between 8 and D, 8 being best, D being hazardous, B still desirable, and definitely declining. Now, I want to mention that the primary factor, the deciding factor as to what grades to give these neighborhoods were based on the population, were based on whether it was predominantly a Black African American community, along with other ethnic minorities. So these neighborhoods that you see in red were deemed hazardous. And I'll go up from this list here. Definitely declining neighborhoods. Interestingly, so there's so much history here, and there's so many resources you can go to where you can actually read specific descriptions of these neighborhoods. I want to highlight Greensboro specifically because there is no redlining map of High Point that I found. So I want to make sure that I highlight Greensboro. And one of the interesting things that was the descriptions of one of these areas, one of the yellow areas, I read a little comment on there that said that this was at one point a great neighborhood, but it was definitely declining because because of the people that were moving in to this neighborhood, aka our Black African American folks. And what's fascinating about this too, as I'm moving along here, is the same map that you see on the screen is very similar to the social vulnerability index that you will find from the CDC. So let's look at the social vulnerability index, and I'll describe it here for us. So social vulnerability refers to the potential negative effects on communities caused by external stress on human health. Such stresses include natural disasters or disease outbreaks, and reducing social vulnerability can decrease both human suffering and economic loss. So having a high social vulnerability means that you are more likely to experience a greater burden if there were to be a natural disaster. Another way to look at this is that the social vulnerability index provides an overview, if you will, of the neighborhood's capacity, the community's capacity to recover from a natural disaster. So as you think about this, I want you to look at the two images that you see on the screen. These are maps that you can actually access, and I'd be happy to share information about that. But I want you to consider that despite desegregation, right after the Civil Rights Act and other strides to make Guilford County a fair and welcoming home for all, many policies and practices continue to uphold a system of oppression that undermine many communities' ability to access good and services that directly impact health outcomes. So here's a great example of what I mean by this. So the image on the left, as I mentioned, as you saw earlier, is a map from the 1930s showing the different redlined areas. And again, redlining is the practice of denying access to credit, specifically mortgages based on race of the residents in that neighborhood, right? So yellow being more of like a caution. In fact, I read somewhere where it said think twice. So if you were to think of this as a street light, if you were to put yourself in the shoes of a lender, if you were to see a neighborhood in red, you'd mean definitely stop, don't go there. Yellow would mean think twice, as I mentioned earlier, but green would mean go. Green would mean yes, approve this loan. So on the right-hand side, we see the Social Vulnerability Index map from 2020. And one of the interesting things, or what I should mention, interesting facts, is that the Social Vulnerability Index, as I mentioned before, is used to assess the community's capacity to prepare for, respond to, and recover from human and natural disasters. One of the things that they consider is social and economic factors, housing, transportation, minority status and language, household composition, and disability status. So the red areas having the highest index, meaning that they are at greater risk of not being able to recover well from a disaster. So what I hope that you see is that there is a clear overlap between the neighborhoods that were considered to be hazardous or unworthy of investment and social vulnerability, which is what we're seeing today. And But let's take a deeper look, or a closer look at some what I mean by this. So on the left is the red line map from the 1930s, and then on the right we see a graphic from our 2019 community health assessment. But you see that so this is Greensboro again. So this is Greensboro here, and then this is High Point. Again, there is no redlining map from the 1930s of High Point. But what I want you to pay attention to is that these areas here, so here's, I guess, like downtown Greensboro, if you will. So we have these areas here that have a large percentage of the population using SNAP benefits, okay, depending or benefiting from SNAP. Very similar to what this map shows us here. Next, I want to look at heart disease mortality. And I want to again point out to the same areas here. And what I'm hoping that you're doing now is that because there is no redlining map of High Point, I want you to consider, if there were a map of High Point from the 1930s, what would that look like? I'd like to suggest that it probably looks something like this, where these areas were deemed to be hazardous. Next, I want to look at persons in poverty. So I mentioned that the communities were deemed hazardous. So this investment was a direct resultant of that. And what we're seeing here is the darker green areas here means that there's a larger percent of folks living in poverty. So darker green is high poverty rates, with lighter green being less chance of being in poverty, living in poverty. So we see the same area here. This is what we're looking at here, and this is what this is here. We see this is the Friendly Hills Sunset Hills neighborhood. If you're familiar with Greensboro, this is Friendly Centers right over here, with NCA&Ts right over in this area here. So you see a lot of similarities here. So persons in poverty, I'll go back here for us in just a moment. So persons in poverty, high mortality rates for heart disease, and percentage of folks benefiting from SNAP or having to rely on SNAP to meet their specific needs. So interestingly enough, so one of the other tools that I want to point out here that shows us the lasting impact of redlining and racial segregation on health is a climate and economic justice screening tool. So this highlights census tracts considered to be of disadvantage. They're considered to be disadvantaged if they meet two specific criteria. And I want to highlight, this is the picture of High Point, by the way, downtown High Point. But I want to highlight a specific area of High Point here. So if you were to use this tool, you'd be able to, again, focus on a specific census tract. So this is between the West English Road and Westward Avenue. We have some High Point Food Alliance partners in this area doing incredible work. But what you'll find here is that the people living in this area are in the 90th percentile for low life expectancy. They are also in the 5th percentile and 96th percentile, 95th percentile specifically for proximity to hazardous waste facilities, so within 3 miles. They are in the 96th percentile of proximity to risk management plant facilities, so within 3 miles. And you'd find similar data points on these areas here. But that's not all. So this is just one area. So these are the same ones. So this area here is in the 91st percentile for the shared number of people who have been told they have asthma and those who have diabetes, 94th percentile. I mentioned I don't know if I mentioned earlier, but this tool categorizes specific census tracts if they meet only two of these factors here. we see that this area specifically in High Point has 1, 2, 3, 4, 5 of these, and life expectancy is one of the lowest here in the nation. So I'll move on here just a moment so we can get to some discussion and Q&A. But I want to highlight what some of the leading health indicators are briefly. But we have air and water quality, housing, transit, recreation places to socialize or to be active, but also tobacco use, immunizations, diet and exercise, sexual health, and substance use. So in summary, one of the things that I want to highlight is that poverty, lack of employment opportunities, the high cost of housing, and other circumstances cause families to stretch their monthly income. These are the root causes of food insecurity. And a study by Feeding America found that people experiencing food insecurity often must choose between putting food on the table and other expenses. These trade-offs often include choosing between housing expenses, medical care, utility bills, educational expenses, and transportation. And historically, people who live in neighborhoods with limited access to affordable, good quality fresh foods due to living far away from grocery stores or lack access to reliable transportation have been considered to live in food deserts, which the area I showed earlier is within a food desert. For an urban area such as Greensboro, High Point, a person is considered to live in a food desert that they have no ready access to a store with fresh and nutritious foods within a mile or so. So I just want to mention that before we go into Q&A or discussion. But last thing I'll say is that, so having to make the trade-offs puts people at higher risk for poor quality of diet, but also a higher risk of developing chronic health conditions like diabetes, heart disease, hypertension specifically, and cancer being our leading cause of death in Guilford County. So I want you to consider again and remember that there's a correlation between what's happened in our past, in our county's past, and I guess and I would say across the United States. But it's important for us to take a deeper look at how these policies have impacted health outcomes and recognize that oftentimes one of the things that I hear is that if people would just eat better, if they would just exercise, then they would be healthier. But one of the biggest takeaways that I hope that you walk away with today is recognizing that there's more than that at play, that there are social factors that impact health. I mentioned earlier where you live, work, and play, whether you have access to sidewalks, whether you feel safe in your neighborhood, whether you feel that you are important and that you're valued, make a huge difference. So in summary, there are power imbalances that impact our community, whether it's food security, whether it's family separation, whether it's folks being denied justice, whether it's discrimination, and whether it's being denied health care or not having the access to public education, especially that being funded for you, being able to access resources for that. There are power imbalances at play, as I mentioned earlier. So lastly, I'll just mention for those who are interested in learning more about redlining and poverty specific and racial discrimination, I want to highlight Poverty by America being an excellent book. Evicted focuses on the housing crisis, but also what it's like to experience being evicted. It's an amazing read. This is the North Carolina specific, the faces of poverty, North Carolina, and the color of law, going deeper into housing discrimination in housing. So I want to pause there, Carl. Or Rebecca,
Okay, thank you, Eli.
I guess we could bring us back.
The one question that we have that popped up is what agencies in High Point monitor equity in home loans, et cetera? Fred, I don't know the answer to that one. We'll find out. So, Wendy, we will get that information for you and get it back to you. The one thing I want to highlight as Eli was talking, just to be very specific about High Point, when you look at one of the census tracts within High Point, there is a 20-year difference in life expectancy versus other parts of Guilford County. And the 7 food deserts that we have at High Point are all impacted by redlining. There is a history here. It takes on a lot of different things. And so the challenge that many people face is not only do they have a lack of access to food, they have a lack of access to healthcare and a lack of access to pharmacies. We were looking at a map one day and looking at the food deserts, and you start drilling down, there are no pharmacies. So if you have a real issue with transportation, then how do you get to a local pharmacy to get your prescription filled? So those are the kinds of things that come out of it. And for many of us, we never had to deal with that, never had to really address it. And so that's the work that's taking place. And so there's not a one-size-fits-all answer to this. It's everybody working together, much like what One High Point that the city council sponsored. It's the results of that and the work that's being done by the YWCA and some of their organizations. So if you have any questions, please put them in the Q&A and we will forward those to Eli and try and answer any questions anyone has.
Mm-hmm. We've got another one, Eli, from Julie McKnight. It says, is the redrawing of voting districts another form of redlining?
Were you gonna say something, Carl?
No.
Yeah, so there raises a factor in that. Certainly civic engagement is what I believe the CDC would call it, is a major factor in whether a neighborhood has been racialized. And so that's definitely a factor. And there's race is a big factor in that.
Right. We've got another one. What are some initiatives that the Guilford County Public Health is doing to help people of color get access to healthy foods in those red line areas?
Fantastic question. So one of the things that we're doing and we're continuing to do is rely heavily and recognize the importance of partnerships and being a resource to those organizations doing the great work that they do, whether it's Second Harvest, whether it's the Food Alliance or Growing High Point, for example. But recognizing that we have great partnerships and finding ways to collaborate and finding ways to help them do the work that they do is one of the ways that we do that. We're also, as far as healthcare goes, is we are working on our new community outreach coordinator. Actually, his name's Toby. He's working on identifying places where we can provide mobile clinics post-COVID. So that was a big thing during COVID. So we're hoping to take what we learned during that season, if you will, and apply it so that we continue to engage our community and take the services to them. So that's one of the ways that we're doing that. But we're also working on rebuilding trust with our community because we found that that's a major factor in being able to provide our services. So we're trying to make ourselves known, but also recognizing that there are a lot of partners who are already doing incredible work. So supporting them is equally important.
So Eli, with all that you've presented, what are some steps going forward? What would you suggest?
That's a loaded question. But what I would hope to see is that I would hope to see, number one, people taking a closer look at our history, especially where you live, and educating yourself on what's happened in the past and how certain policies or practices or programs may have impacted the health outcomes that you're seeing today. Recognizing that when it comes to social determinants of health, whether you're a health department or a nonprofit, you're playing a major part in addressing health outcomes. But there are also major other factors that impact it. So recognizing that there's no one solution to these issues, but there are multiple. And so working together is with partners and advocating, as I mentioned earlier, speaking with your city council members about what's happening with policies and funding and that type of thing on a local level is important. So I would say those would be some practical ways to do that, but you can also engage with your other elected officials and ask questions about from a curiosity standpoint to see what's happening within the county and city level, to see what's happening about and how they're working to address these issues.
One other question. So what do you think is the role of local government?
That's an excellent question. The role of local government, the role of local government, I would say, is to serve the people. It is to listen to the people. It is to provide a voice for those who don't have a voice, and it is to serve them. It is to be able to meet the needs of the community, be able to allocate funding, allocate programs and resources to make sure that we're meeting the needs of those who have them. But also, I think local government has a huge role to play when it comes to the creation of new policies. Funding is a big one from our county perspective. Where and how the money is allocated makes a huge difference. So I would say that in a nutshell would be the role of government. It is to serve the people and to listen and provide opportunities to be heard.
So Dr. Webb's asking the question, have we ever considered the establishment of a board of community members who could speak to their needs and potential best practices?
Yes. Last year we participated in a program called Building Trust, focusing on building trust with community partners. And one of the recommendations from our community members was that there is a need for community members to have a voice at the table when it comes to making decisions. So currently, from our Guilford County perspective, from a health department perspective, we have a board of health. But one of the things that we're advocating for internally is for us to create some sort of advisory council that would play a major role in voicing and representing the community so that they would voice their concerns. Oftentimes, one of the things that we've heard in the past is that oftentimes as a local government, we come with people with solutions and things already in place without necessarily asking the community what they need or if that works for them. So definitely think that there's a big opportunity to do that. And I'll continue to advocate for it, but I also would ask you to do the same.
Just as information, part of the model for the Food Alliance is actually community engagement, where we have community members who serve on our board. We have neighborhood representation. And as much as possible, we try and actually have our meetings in the neighborhoods so we hear back from people. It's never a matter of going in and saying, this is what we're going to do. It's always a matter of, what would you like to do? How can we help you accomplish what you want to accomplish? And we're seeing that model being played out more and more and more in the community. There are some things that are coming in the near future where we'll see more community participation in addressing some of the needs that we have in our communities. Any other questions?
Eli, we've got another one in the chat. It says, how do we determine those with legitimate needs within these areas of the community and those whom are taking advantage of the help that's being provided?
That's an excellent question, Carl. I don't know if you would like to comment on that.
That's always the struggle. If you are working in a direct service like a food pantry or shelter, and I guess the premise that I've always taken is that we'll serve whoever comes our way. And you cannot judge need based on what a person is driving or the clothes that they're wearing. That's why it's really important to build relationships with people, to learn their stories. You never know when somebody lost their job 6 months ago, and that Lexus they're driving today might be repossessed tomorrow. So the other thing that we see, especially in the environment that we're in right now, is that we have people going to food pantries and other places for services that have never been before because the cost of living is so much, especially for those on fixed incomes. And so we're seeing a greater demand. And so, but I think you can do screening, you can do all that kind of good stuff, but we can never, ever assume based on what a person's wearing or driving or living that they don't have a real need. There was a report that was done years ago by the Brookings Institute, said that suburban poverty in the triad was one of the fastest growing rates in the United States. People can be house rich and everything else poor. So we always have to keep that in mind. And so if they come, we'll serve them the best that we can, and we'll just take care of the needs as we can.
Yeah. I'll share a story actually from one of the programs I participated in last year. It was a program on the Mediterranean diet, and one of the participants had 5 degrees. She was a doctor, master's, undergrad, master's, PhD, like 2-3 PhDs. And when I asked her about what some of her challenges were, was that she was living on retirement. She was retired and could not find a job. I believe she was 62. She retired early, early-ish, I guess. But so she couldn't find a job. She'd never been to a food pantry. She didn't know where to go. So when I asked her about if she'd like, we came to the part where we're like, okay, what, do you need resources on how to eat on a budget, for example? She was like, I have no budget. I have no budget. There is no money. My car's breaking down. Like I barely have money for gas. So this was a really interesting, fascinating experience. Because as Carl mentioned, you have folks who are educated, who, on face value, you think that they'd be okay, but truly we don't know.
Are there any other questions? All right. We really appreciate you taking time today to be with us. We appreciate Eli sharing. I just want to make sure that I give a shout out to the folks that have really helped make this happen. We've got Rebecca Oakes, who works with Eli, Alicia Caldwell, Rebecca Dobbins, and Sarah Barlow, who all work with me with the Food Alliance. They're the ones that have done all the work on this. And like I said, this is the first time we've tried this. We appreciate any feedback that you can give us through the surveys. One more thing I want to just let you know that we have upcoming lunch and learns in the future. The next one will actually be with Eli, with Hosea Brua, and he's going to be talking about urban farming and the impact on sustainability and the food systems. That will be on February 21st. And then March 20th, Dr. Liang with North Carolina A&T will be talking about the research that she's been doing. That was one of the requests that's come out of the Food Summit. So we're going to do a series of 5 of these. We appreciate your attendance, taking time to be with us. And again, Eli, thank you for the information. Thank you for putting all this together. All right. We hope everybody has a great rest of the day. And one of the DNA, part of the DNA for the Food Alliance is either finishing early or finishing on time. And we're finishing early today. So y'all have a good rest of the day. Thank you.